Hello.
Hi there, how are you today?
Good. How are you?
I'm good. My name is Briley. I'm going to be your nurse practitioner today. How you doing?
Good.
Is it okay if I ask you some questions?
Sure.
Perfect. So what brings you in today?
I'm just doing a normal checkup.
Okay, and can you tell me your name and date of birth, please?
Lauren Hernandez, 5/22/1990.
Perfect. So let me ask you some questions. So today we're going to do a general assessment on your abdominal area. Have you had any pain lately?
No.
Any nausea or vomiting?
No.
Have you had any difficulty eating, swallowing, or anything that's affecting your appetite?
No.
Any history of GERD or acid reflux?
No.
Any family history of any abdominal issues?
No.
Perfect, okay. Well, if you don't mind, I'm gonna go ahead and start my assessment.
Okay.
Okay? So the first thing we're gonna do today is we're gonna inspect the abdominal. So I'm gonna lay you back all the way down. And can you lift your shirt up for me just a little bit? Perfect. So I'm just looking at the abdomen. It's symmetrical. I'm gonna pull this down just a little bit. So it's symmetrical. I don't see any bulging, any areas of ascites or pressure. It looks pretty flat to me, okay? So I'm not seeing any scar tissue. I'm not seeing any areas of the skin that look altered. Her skin is nice and pink and dry. And also I don't see any heaving or palpations just from looking at you. So next thing we're gonna do is we're gonna go ahead and check your bowel sounds, okay? So I'm gonna listen to every quadrant, which there's 4 quadrants, and I'm gonna listen twice in each quadrant. Perfect, so all areas are normal active. The next thing we're gonna do is we're gonna go ahead and look for bruits. Bruits are little pulsing sounds you might hear where the major arteries are. So I'm gonna check for your aorta, which is gonna be right here, the kidneys on the sides, your iliac artery, and your femoral artery. And we're gonna do that with the bell. Okay, now the iliac. And femoral. Perfect. So next thing we're gonna do is the scratch test. This helps us identify the location of the liver. Okay? Oh, let me put this like right there. Perfect. So what I'm checking for right there is to see when I scratch areas that are not over the liver, it's going to be a lot harder to hear the noise. But as I get closer to the liver, the noise gets louder. That lets me know when I hit the liver and where the liver ends. And everything sounds good. So next thing we're going to do is percussion. We're going to palpate the liver, the kidneys, and the aorta, and also the spleen. Okay? So to palpate the liver, I'm going to start right over here. And we're going to do areas of light pressure and deep pressure. So we'll start lower. I'm going to go ahead and have you breathe in. Good, you can look up. So the liver is palpable, which is normal. Next, we're going to do the spleen. Go ahead and breathe in again. That's light, and now we're going to go deeper. And the spleen is not palpable, that's normal. Now we're going to do the kidney, so I'm going to take my left hand, place it behind the back, kind of turn you, and go ahead and push. And I'm going to, so light pressure, and then deep. And the kidney is not palpable, which is normal. And now I'm going to come over here and do the same thing. Left arm, I'm going to go around the iliac crest, and we're going to push. So light pressure and deep. All right. And last but not least, I'm going to check for any aortic pulsation. So I'll just put both my hands right here. Perfect. Okay. So next thing we're gonna do is we're gonna check the femoral pulse. So I'm basically just gonna listen right near the femoral artery, okay? Perfect. And the other side. Perfect. And now we're gonna go ahead and palpate the inguinal lymph nodes. So I'm just gonna rub. Okay. And I don't feel any swelling or any abnormalities. Nothing's protruding. Any pain anywhere? No? Okay. Well, that's gonna conclude our assessment for the day. Do you have any questions for me?
No.
No? Well, thank you so much.